Harpreet Singh, and I think a lot of you guys have read my posts and stuff. So the reason that we came up with this theory group is we've been running the practical classes for a number of years, and then a lot of students approached me about help, about how to study, about for theory. So we've been thinking about this since a couple of years. So a few years back, we came up with this group of great teachers, Adam, and then we have Agnes and we have Ramesh. And so we all got together, and then Adam and Agnes got this wonderful study material guide going on, which had almost everything. The main thing that we found, that meaning I found, was that whenever students attempted theory questions, we have a British system of education, especially in India, countries like India, Pakistan, and everything. So we are more into cramming things. This exam is more about understanding. So if you understand your concepts, you can easily answer the questions. The answers are all right. So there's not single wrong question. They're all right answers, but you have to choose the best answers. So what we have done is, in this course, is we are going to do one-on-one classes. So for example, last batch we had 17 students in our batch, and the only issue that we had was we didn't have an online version. So they had to come to the clinic and then had to attend the classes. For this year, we're going to do this online. So anybody, you guys are watching in Toronto or Saskatoon or Edmonton or Calgary, you can just sit at home, watch our live classes, and then hear the examiners and then ask questions. So it'll be a 10-week course that we're doing this year, and there'll be 2 classes on MSK, 2 classes on neuro, 2 classes on cardio, 1 on ethics and peds, and 1 on multi-system. So after every 2 classes, there's an online mock exam. So the online mock exam is of 100 questions. So these questions will be online. We have grouped up with a company who's hosting our exams. So once you're registered, we give you an email. You just have to log in within 48 hours, attempt the exam, and then you will be given your scores, questions that you're wrong, that were right. So all will be given you by that software. Our next classes we'll be discussing. We'll be giving you feedback about the questions. We'll be discussing all the questions that were in the exam. So after that, we'll have a neuro class, neuro 1, neuro 2. Then you'll have another mock exam online. Will be of 100 questions, and then again, the next class will be 100. So all this format is on our website. What we've also done this year, in the last year or two, is that on our website we have a discussion group. So like a lot of people know about this. So all our examiners, all our instructors are going to post questions. These questions are Vigilant questions, and you will be asked to post your answers within 24 hours of the questions. So the reason we want to do this is, once you are attending the class and when you're going home, we want the students to be involved. Right? So we want them to be involved in discussing. We want them to be involved with their peers, and then just think the thought process. The whole thing about this course is we want to change how you see the questions, how you critically think, right? And you can understand the concepts. And again, same thing about success rate. We have had really good success rate so far, but that's not we don't take credit for it. I think this is our students that have been working hard and passing. But we also have a WhatsApp group that every batch, and then if you have stuck in something, you can always post some questions and ask us. Any questions?
It's just 10 weeks, or do you have something else to make the student go through that, just get prepared by themselves and then go to the classes?
So what we usually do is, before starting off this course, we are going to give you what we're going to do in the class. What topics are we going to cover? So we expect you to read those topics, get well versed with it, and then come up in the class. So in the class when you're attending, so for example, Ramesh when he teaches MSK, he's going to tell you, he's going to pick up topics and going to tell you what is important, what kind of questions can come, and then we'll discuss some mock scenarios. So all these scenarios, mock tests, are all made by us. These are not previous exam questions, or they're not PCE exam questions. These are all just made by us. So we open our books, we choose what is important, we make those questions, and we have students answer that. But we definitely expect everybody to read before they come to the classes, right? And then if you're attending online, to be there online, and just ask a lot of questions.
So are you going to provide with the materials, like the topics which are going to be covered in the lectures, or do we have to prepare by ourselves by reading the books and so?
What we expect is, because you have already passed your physiotherapy degrees, right? So you know what MSK is. Right? So we have divided our first class into lower extremity and spine. Right? So we want you to read as much as you can about lower extremity and spine. When you come in the class, we're going to start from foot, knee, hip, T-spine, L-spine, right? What is important? What is not that important? What kind of questions can come through these? We'll give you scenarios and we'll discuss these scenarios. We'll give you some mock questions. We'll get your feedback. We'll discuss those, right? But we expect you to at least read. We're not going to explain you conditions. We're not going to teach you. We're not going to teach you, what is coxa valga, or anything. We expect you to know this, right? But we're going to teach you, what kind of questions, what different angles, what topics you need to read, which books you need to read, how to, go through our study material, and things like that. All the exams are online, so you can be anywhere in part of Canada or India, and then you can just log in, and you have 48 hours. You have an hour to do 100 questions. Once you're done, hour to 1.5 hour. Once you're done, you can't just stop the exam in between. You have to complete it. Once you're done, it will show you the correct answers, give you your marks. Good. So if you guys have any questions, or you guys have any questions, you can always go to our website. Our website is pceexamalberta.com. If you just Google it, PCE Exam Alberta, it will come up. Any other questions?
And when is the course going to start?
The course is starting May 17th.
So that time is enough for the freshers?
So 90 days. So another part is, before the course, we're going to give you a 90-day study plan, right? So that's what we recommend, that you study for 90 days. You can study for more, but it's sometimes too much, and then you start losing steam when you come near the exam. So people who are studying 6 months, and then, for example, if they're doing exam in May, and then in April, they get so tired and fatigued that they can't just push. Because in May, those last 30 days is the when then you have to study 10 hours, 12 hours every day, right? So 90 day is more than enough for theory, it's more than enough for practical. Okay? So we'll give you a study plan, what to do, what by 30 days, what should be completed, what by 60 days should be completed, right? So all that stuff will be provided. Any other questions? Let's just, I think we're done.
So coming to my part, so I'll be teaching about, as I said, that musculoskeletal and other things. So raw materials, everything which is required is given in the material, and then different source of reference books, and then you too might have many reference books with you. So you'll be going. So my job is that I will try to discuss most of the scenarios which they call it as vignettes over here, most of the cases and scenarios, they will be giving in the examination, and then how to interpret these answers, what are the traps which they usually give. I'll be discussing a couple of things over here, and then what are the important guiding points which you should be looking for in the multiple choice questions, because in multiple choice questions, they themselves has a guiding lines over there, so you can just look into those things, they will actually guide you. So I'll try to discuss some of those questions in the future. So exactly what we render at here, so to quickly to say about, we'll be rendering the direction in which you should go first. Say for example, if you are aware, so village square is over here. So if you exactly don't know the village square is in, you want to search for village square. If you turn opposite and then keep searching for village square this direction, you may have to go through entire northeast, sometime entire Calgary. Some people end up going around the globe to come over the village square because you are moving in a wrong direction. What we are trying to give is, please, the exam is extensive, we try to give the direction. And second thing is, we'll try to give important tools which are like material, and then mock tests, tips. They are some of the important tools. Say for example, if I want you to dismantle this chair, so you can dismantle even with your fingers or mouth, try to dismantle it, but you may end up breaking your fingers, tearing your mouth, all these things. We give you tools like screwdriver, everything, so that you can easily do it. So we'll make your jobs easier for preparation of the examination by giving you the tools which are required for it. Other thing is what we are going to do is we respect your graduation. So perhaps you might have your bachelor's degree and master's degree, and it has been accepted by Canadian Alliance of Physiotherapy regulators, so that your degrees are equivalent to the Canadian system of education. So we respect that one. So having respected that, what is our job here is to enhance your perceptions in the physiotherapy. So you may be knowing all the things which we say, but only thing is you need to correlate them. Say for example, we'll start with this one, and then I'll give you one multiple choice question. We'll try to scenario wise we'll try to discuss. Say for example, a patient has an ankle fracture. So you know that whenever there is commonest fracture is there, so they should be landing up in downwards, foot should be plantar flexed, and then it should be inwards. So we should know about the mechanism of injury which is there. So downwards, inwards. So that will be the first question which you should be answering. That comes under mechanism of injury. Second one is you are going to diagnose it. How you are going to diagnose is you are making it as a provocative test. Say for example, if you don't know the provocative test, if you have not heard of provocative test, I'll say you the mechanism of injury, and then for example, I don't know whether you know it or not. For example, we'll assume that you don't know. So if the mechanism of injury is downwards and then inwards is the mechanism of injury. When you are testing, how will you be testing? Say for example, if you don't know any test, how will you be testing that particular ligament has been injured? How will you test?
Like ask the person to do the movements, like just try
No.
toss.
Yeah, so what you're going to do is, that's what we are going to teach. Say for example, if you're stuck in a pathway where you don't know what provocative tests need to be done. So name itself says that provocative test. That means you are going to provoke someone. If you want to provoke someone, so we should exactly elicit the same movement which has happened here. So what is the movement which has happened? Downwards and
Plantar and
inwards. So you're going to put, so if you're stuck in a pathway where you don't know anything and then you're hearing it for the first time, we will enhance your perceptions about the physiotherapy, that okay, if you don't know, downwards, inwards, yes, this is a test, what we are going to do. Understood? And then we'll try to discuss, and material gives you which is the commonest ligament which is injured, how to perform the test, which test has to be performed, anterior triad test, anterior talofibular ligament, all those things you'll learn. In class what I'm going to do, we'll enhance your perception about your ankle joint injury, saying that okay, this direction, name itself is provocative test. That means you're provoking the pain. In order to provoke the pain, you should move the limb in a direction in which injury has happened. That's what we are going to say. Now you understood how, now you know for shoulder how to do it, knee how to do it, now you know. And then see, entire Canadian system of question paper formation, because we don't know how the questions are made. No one knows how the question is. Some XYZ people have made bundle of questions and they're made, but they have a fixed component. Why? Because Canada has free Canadian healthcare system. So that means all the treatment which has been given is free of charge. Say for example, if a patient comes to you, same ankle ligament injury patient comes to you, and then you try, once you treat the patient, you are trying to keep with the crab bandage, what you call, they call it here as a tensor wrap, and then you put the tensor wrap, and then you send the patient. So, but after wrapping and before sending the patient to home, you need to say something to the patient. That is what you're going to say is, look for the signs of compression. So when you wrap the tensor wrap, it can be too tight. So when it is too tight, blood vessels will get compressed, nerves will get compressed, and as if blood vessel compresses, what can happen? So decrease in blood supply, and then they will be having pain, swelling, change in color of the limb, etc. If nerve is compressed, what can happen? Pain, pins and needles, and eventually paralysis. This kind of things happen. So if you don't say that, what you have to say to the patient, regularly remove the tensor wrap once in 3-4 hours and again do it. Why? Because it should not be a hard tourniquet event. You need to unfold it, remove it, keep it, leave for some time, again tie it. This you have to say. Second thing is, at any point of time, if you develop pain, you might have heard about 5 P's. If you develop any pain, pins and needles, change in color, and then excessive swelling, if you find this kind of stuff, what I have to do is go immediately to emergency. What happens if you don't go immediately to emergency? There will be decrease in blood supply, distal to the tourniquet, that means to your toe part. So continuous decrease in blood supply, ischemia, gangrene, Necrosis, what is the treatment?
Cut them.
Amputation. So who is going to pay for it?
Yeah.
How much they have to pay? Government has to spend around $15,000. So if for one physiotherapist, if you consider one mistake has been done per month, so what will be the load on the Canadian healthcare system? That they don't want. So now you understood what type of questions to be dealt with. So they don't want any loss for them. So you should be there creating no additional burden to this one and rendering your own service. How much to render? That is your professional boundary. How much to render? That is your professional boundary. You treat the patient for 5 or 6 days, no improvement, refer them to this one. And the same ankle person comes, you quickly check for whether there is fracture or not. If you suspect any fracture, send them immediately to the physician. That is your job description. Now you know why they want physiotherapist, in which parameters they try to test, and then which will decide your pass or fail is only these things where you are not causing any additional burden to the Canadian healthcare system. So I just assume, so if 600 physiotherapists are there in Alberta, so if everyone does one mistake once in a month, what will be the average loss for the Canadian healthcare system?
A lot.
Huge. So they will ask the question paper setters, please focus on these things. So what is our job is to look for all the set of some 20-25 reference books are there. So it is our job. So because I have been in teaching field for so many years, so I was a professor back in country. So what happens is they will pay me if I read. So I've been reading all those things. That made my job easier now. So rather than student reading all the books, what we try to do is from these books, what are the things which are hazardous for the Canadian healthcare system? We have traced it and then kept it. We are going to share to the students. That is one. And then you have been asking, I understood that neuro component, muscular component. In case of, say for example, if a patient walks into your clinic or when you walk into a Peter Lockett hospital or any hospital, so you cannot expect only musculoskeletal to be there. You cannot expect only nervous system to be involved because they might have different problems. So they try to mix one case with the other case. That means your brain should be sharp, switching from musculoskeletal to neurological things, neurological to cardiothoracic things. You should be switching enough. Say for example, I'll try to do. Say they say that past 50 years a person is having emphysema. What do you understand by it? So 50 years he is having emphysema, and then they say nothing about it. Past 50 years he has emphysema, there is tingling and numbness over the ulnar aspect of that. What do you understand by it?
There must be any musculoskeletal.
What musculoskeletal can be there? So you need to, that's what we teach over here, that past 50 years emphysema. Past 50 years emphysema means past 50 years he has been using accessory muscles of respiration. What are the important accessory muscles of respiration? Your scalene muscles. Everything you know. Everything you know. Nothing new I am teaching over here. Just we are trying to correlate. You have scalene muscles. What happens if you continuously exercise biceps for 6 months? Hypertrophy. What happens if you continuously use accessory muscles of respiration for 50 years? Hypertrophy. What if scalene muscles goes for hypertrophy? What can get compressed? There is a small space between two scalene muscles where your brachial plexus has to go. They get compressed. There is no space. What happens? You cannot see this one. So we have started with cardiothoracic sciences. We ended up in here. So they may ask few things about emphysema in assessment and then management, what type of exercise, what is the use of pursed-lip breathing, what the patient does, and then some little bit of pH values, etc., CABG. These were the rest of the things they will try to ask. And when they come to thoracic outlet syndrome, what is being compressed over, they may ask few tests for diagnosis. Now you understood, we are here to correlate one system to other because the patient presents as a whole. He won't come with only musculoskeletal problem. He won't come with one singularity. We are here to correlate those things. So all I did is everything you know. You know that emphysema patient has difficulty in breathing. He has hypertrophy of this one. Thoracic outlet has all these features presenting over in the ulnar side of this one. Everything you know. What we have done is we have increased your perceptions regarding these two conditions combined together, so thereby you will able to understand in exam. So in exam you will answer this question for sure, but you may take 4 minutes. That means 4 minutes means you may go wrong. If you go correct, then it's fine. If you go wrong, you not only lost this question, but also you lost other 3 questions which are there. So our job is how to manage the time management, all those things we try to, when to skip the question, when to carry on with the question, which question is yours, which question is not yours, and so we are going to manage with those things. Understood? So I think then we need to go for ethics component, safety component, Understood? Because only based on these parameters you will be judged. Understood? So we try to cover scenario by scenario like this, all the topics which are there from the different textbooks which are available, so that even examiner, question paper setter tries to play with one set of books, another set of books, as we have been covering all the books, so it should be easier to get into the things. And then we'll try to give you the tips, and then what are the traps which are present over there, we'll try along with the guidebook which we have been providing. So if you start with, once you have mastered it, meanwhile our classes will start. Once that classes literally starts, we'll try to discuss, say, case by case, case by case. But the problem with the reference books is it is a terminology, self-explained terminology. Reference books, whenever you are stuck with our material, whenever you are stuck with the questions which have been done, you'll go for reference book. So you can Google it for sure, but what happens is Google will not come and defend you about the topic. If it's from the reference books will come and defend for you. Goodman will come and defend for you. Darcy Umford will come and defend for you. And that's why, because that is what Alliance has given as reference book. Try to take from the reference book. So when you are stuck, go to reference book, if not this one. So, but it is beyond the scope of students. It takes minimum 4.5 or 5 years to complete all the 20 reference book, if you assure yourself that you won't forget what you have read in the first book. Understood? So it becomes very easy. That's why we are here. So when you are stuck over there, we do the job of reference book. So we, I think they create a WhatsApp group and other things. So you can post us, and then we try to get back to you. And then you have your own groups. That means all the students who have been preparing, so they will be there. You can discuss about things. So that we give you a good platform for this one. And then regarding success rate, so there is no precise formula for these books, because we teach to all the students. Understood? 11th standard or 12th standard, your mathematics teacher or biology teacher might have taught to all the students. One student gets 150, other student fails. So it's not about the teacher, so it's about the student. Teacher tries to give best, but here what you're going to do is, yes, if you personally ask, this is what I want, so it is my responsibility to teach you. Understood? We make scenarios in such a way that you won't have any problem. So now I have said one thing, so now you're clear with what you have said. So like that we try to see, so perhaps you may not have any doubts regarding that. Good luck. Thanks.
Welcome to our info session on the Theory PCE course that we're offering. Basically, this is just an info session and giving us some general study tips on how to prepare for this exam. We'll also be going through some of the supplementary course material that we have for this course. Basically, what we developed in the last year or so was a fair bit of material, almost about 350 pages worth of material that we've gathered from several different texts and sources and that sort of thing, and mostly from online. And we've created an interactive document. So as you can see, this is our MSK part 1 of 4, and it has a table of contents. It's all done kind of on the computer online. So let's say we wanted to go over Dupuytren's condition, it would just have what it is, and this is all under fasciitis or fascial tearing or myofascial restrictions. So it'll just go over what it is, generally speaking, and the assessment and treatment of it would be kind of above and below. So just general summary, very big kind of summary of what you'd want to do and what some of the signs and symptoms would be. So that's just really generally what we have, and I'll just spend a bit more time going over the table of contents. So we really tried to cover from every type of, this is just directly based from the PCE blueprint. So what we did was we took the PCE blueprint and then we researched as much as we could all of the different topics that they would want to be covering. And then together what we did was we created this document. So we do have pelvic floor dysfunctions, osgood sliders, and just going through it, it has really generally pictures, diagrams, also videos on what to do, as well as certain tips that we have along the way on what we think that they're looking for in the PCE exam. Now, just a disclaimer, we are in no way affiliated with the PCE exam, but using some of our collective clinical knowledge and experience with this exam, we put this together. But as we can tell, there are pictures that are referenced from Wikipedia and open source materials that just generally show, okay, this is what the fulcrum is, this is what the different types of levers are, and just some of the general principles that they would ask for the theory portion of the PCE. Okay? So I'll just quickly flip through it. has all the different joint types and joint sockets. And then when we go all the way down to part 4 of the MSK, there's a whole assessment feature. So this just has all the special tests that we're looking for, general positions, what would be positive, just very general, because this is a competency exam. This exam, all they're looking for is basic knowledge of entering into the physical therapy realm. They're not looking for expert manipulations, exact handling. They just want you to know if you can identify kind of what red flags are, what are normal range of motions, what's open back, what's closed back positions, and but they want that through basically everything that a physiotherapist would encounter in Canada to practice safely. That's the main thing about this exam, is that it's quite different from other types of exams in the sense of, oh, you're better than other people. No, they want to create just a baseline on what is safe in Canada. And that's really what the goal and intentions are for this course. So just to quickly go over this document, we have the special tests, and then later on, once we go a little bit further, we do have kind of normative values on what open and closed back are, and you may have some of this in your text back home, but this is just what we believe that they're using here in Canada. So there's slight variation, but we recommend this. Then we have as well,
They can find table of contents on the
table of
website.
contents.
On our website.
Absolutely. On the website, it can just demonstrate what we actually are covering, capsular patterns, all that other stuff that you already know, but need a little bit of refresher for that actual exam. And then assessment flow, what we think is important, how you should go through red flags, obtain informed consent. And I'm just going to spend a little bit of time on this because it is quite a large document, and we do find it very useful for people about to take this exam, just because it does cover everything. And since physio crosses so many professional realms, it is hard to get all of that information in one source.
My name is Harpreet Singh, and welcome to our 2016-2017 first session on the written component of the PCE exam. I usually conduct practical classes, but we had a lot of requests for the written exam, and then I wanted to do something different, some things that nobody has done ever, and I was very lucky to have, I was very lucky to find two great U of A students, and now U of A physios, Agnes on the left and Adam on the right. So Adam and Agnes have worked really hard, developed a study guide. They made a study guide just based on the PC exam. Thing about starting this group is that there are a lot of groups going on. So same with the practical. We just want to make sure that everybody can join. Right? First thing is, and we have some material to do, and we can do one-on-one classes. So we are in Calgary, so I think for Calgary students is easy. So we have designed this whole course that we can give you access to the guide online. You can go through the guide, read any topic. So if there's any topic missing, then we will make sure we'll add it. But so far as I know, there's nothing that is asked in the exam that's not in the guide.
Adam and I wrote this document over the summer, and it took 3 or 4 months to finish writing it, and it's quite comprehensive. There's about several hundred pages actually. And so how we actually went about writing it, we based it on the blueprint that's posted on the Alliance website, and then so there's a table of contents which helps with, and then we put in all the notes into that document under each of the sections for the blueprint. And another thing that we did is we gave a lot of examples that you might not find in some of the other study guides. So for example, in the blueprint, they might have ligament injuries, right? And then under that, we would have like general, how do you assess, how do you treat? And then we would give examples of the most common ligament injuries. So that I found very helpful, because it's good to have a general idea of how to assess and treat. And that's usually what the study guides out there they provide. It's very general. but we gave specific examples that we learned in school, or examples of the most common injuries that we saw in our clinical placements. And for most of the conditions, we try to give very specific things like, what would you ask during subjective history? What would you likely see during an assessment? And then based on that, or the timeline of how acute or chronic it is, how would you treat it? So a lot of that was either from our stuff that we learned in school or our labs, or from our clinical placements, which I think really helped with the exam, because generally speaking, they would give you a very specific example in like a scenario that you have to read. So the more specific you can get when you're studying, I find that more helpful, because it does vary a bit depending on the particular ligament or the timeline of healing. So other than that, like I said, it's very comprehensive, but it's also very organized and concise at the same time. We made sure it's only material that's relevant for the exam, hence organizing according to the blueprint. We also have sections that we learned in school, but it's not specifically on the blueprint, but it would be good background information when you're studying. So everything's together in one document. For example, we have a section on modalities, which they do ask, unfortunately, on the exam. They do ask about that. Imaging. Sometimes they ask questions about particular imaging, how to interpret a chest x-ray, for example. That's stuff that we need to know. Lab values, that's something they like to put in, but we often forget about them. And just because there's so much variability in the lab values that you learn, depending on where you learn them. So these lab values are the ones we were taught from school, and the ones that they would go with the Canadian exam. So those are good numbers to memorize, especially with scenarios that are trying to test you on contraindications. If platelets are lower than this number, you shouldn't, do this. So you have to know those numbers. We also have a pretty detailed section on medications. They like to ask questions on side effects. So when you're screening, this is what they're experiencing. What could it be? So we have a pretty detailed section on medications according to the different categories of medications, the most common side effects that usually they would test you on. So it's easy to read, and how those medications work, common names or how to remember them, things like that. We have a section on psychological disorders, which is actually on the blueprint, but it's very brief, and a section on aging and pediatrics. So they could ask specific treatment or assessment related to that age group, especially with changes in physiology with aging. That's something that they could test us on. We also have a section on exercise physiology related to the effects of bed rest. From our school, we had an entire course on that, just on the effects of bed rest and exercise physiology, which is a lot of review if you have a kinesiology background, but if you don't have a background in that area, it's good to read up on that. And then we also have a section on outcome measures. So it's very organized, and it has a list of different outcome measures that are commonly used according to different conditions, commonly used in Canada. And there's details on scoring, how you would score them, how to interpret the scorings, MCID, pretty much only the information that you would be tested on. So if they throw in an outcome measure in the scenario, you should be able to know how to interpret that and use that in your clinical reasoning. But not too much detail in terms of how do you actually administer it, because you don't need to know that for the exam. And then lastly, a section on ethics, which to my knowledge is not in any of the study guides right now. And unfortunately, that is an area where a lot of people struggle in. They get so tied up in memorizing all the hard facts, they forget about the ethics. And that's an easy part, to fail at, because they're very specific to Canada, the different legislation and rules. And also things that we've learned throughout in Canada, they value ethics a lot. We had 4 or 5 courses.
We had 5 ethics courses on professionalism, and
Yes.
And also in evidence-based practice. Now, evidence-based practice isn't on our exam. It was examined differently, but they definitely, there was at least 7 or 8 questions that was like, in this situation, what should you do?
Yes, very specific to ethics, depending, and in professionalism. So there's a section on that, and very relevant when we
Can you
wrote
show
the
the
exam.
ethics section?
Just because it's not tested for the Canadian exam, they test a lot of endocrine stuff or reproductive systems, which is not on our blueprint. So that's a lot of unnecessary material for you to read on. That's a waste of your time. Whereas this study guide is very geared towards the Canadian exam, and it's completely written according to the blueprint. So that's one difference. So it's important to be specific, but at the same time, you have to know the general flow. So in the document for
Cardio.
musculoskeletal, cardio-rest, and neurological sections, we wrote a general framework of how to assess. And that can vary depending on, you know, where you learned your training, but this is what we were taught in the Canadian system. This is the general flow of our assessment. What are the things that you have to screen for? And a huge component is screening for red flags is something that they emphasize a lot in. It's one of our first courses. A lot of the clinical reasoning is how do you screen for red flags? Things that you can't miss. And because if you miss, someone could die in a hospital environment or get severely injured. So that's a huge part. And a lot of it is, I think, learning that general framework first helped me, and then going into the specifics of, you know, particular conditions that are common. And then in my head, I would run over, if someone came in with this condition, what would I expect the history to sound like? What would I expect to see on assessment? How would that vary depending on their age? And other comorbidities that they could have could make things very different and complicated. So for example, with people who have urinary, bladder urgency, sorry. Someone who comes in with that, you might think, oh, you know, pelvic floor issues, we can work on that. But there's a lot of other things that you have to screen for. Could it be a neurological cause? Multiple sclerosis? You know, what age are they? Do they have the common risk factors, right? Could it be cauda equina? Did they have a recent, you know, there's a lot of things that they want us to be aware of and screen for safety reasons. And that's an easy area to get caught up on, I found. And again, like what Harpreet said, time management is key. There's 200 questions, not a lot of time, and they're not long scenarios, but there's quite a bit of reading. So you have to be able to read, understand the entire picture of the scenario, and then quickly make a decision and move on. There is not a lot of time to go back to check the questions that you flagged. I didn't have a lot of time to do that.
Me neither.
And it's a pretty high stress environment. And I guess that separating it into categories was useful for my studying. So for the first 2 weeks, I spent my time on musculoskeletal. And knowing the weighting in the exam is very important. So neuromusculoskeletal is 50% almost of the exam. So we prioritized our studying on that. We spent, out of the 5 weeks, maybe 2 weeks on that. And then around 10 or 20%, I forgot it's in the doc, cardio rest, right? So prioritizing is very important. You don't want to spend, 3 weeks on cardio rest and then forget about what the majority of the exam is on. So that was important.
Just on that note, so basically for us, the Alberta Physiotherapy Association College has a calendar of what they recommend for us to study. And this is based right after we finish our actual courses, so it's still quite fresh for us. For some of the people that have been out of work for a few years, I would probably double it. But basically, there is a 6-week schedule on what you need to cover, and basically we can. I suggest it has days off, but it has that day study cardio rest, study assessment, study this, and it's pretty detailed. And I definitely found that helpful because when you're trying to divide your time right before you're going to take the exam, this was something that I thought was very useful. And then the actual day of the exam, I made sure I relaxed. I stopped studying a few hours before. I had a good meal, I enjoyed walking around with my wife, and just like relaxed. And then I went in there, I had a good smoothie, like some food. They let us take in a smoothie. I don't know if they let us take in food now that I think about it. And I just looked at the question. When I didn't exactly know what the answer was, I just looked at it in the sense of, if I could do one thing to this person, what would I do? What answer is best linked to that one thing I would do for that person? And I think that helped a lot. We both did quite well on it. And so I just think that there are 4 right answers, and in clinic, yes, you would probably do all of them. But just choosing the one thing that's most important, the safest, what is the most appropriate action that you would perform if you could only choose one thing, that's kind of my go-to way of eliminating the answers that aren't exactly correct. And the trouble with that is that you guys all come from various backgrounds. And luckily depends on the perspective, but we've had 6 placements and different areas of practice. I've worked with Harpreet, I've worked in neuro at Foothills, and so we know what the Canadian standards are. But based on your clinical knowledge, that's absolutely one of the most important things, is to say, if you do one thing, what would you do? And all of the other information, review, take the time, put the effort in, make sure that it is a fair bit of time, depending on how long out of practice you are, because there are a lot of specifics. And the other point in the exam is that there are some questions in the exam that are actually trial questions, so they don't count. They look at the psychometrics of what that question actually added up to. So when you write that one question and you're like, I had no idea what that meant or what they were talking about, there's a possibility it's not even going to be counted. So don't sweat too much about it. It's really easy for that exam to get stressed out. I think people walked out there not feeling 100% good about it, because just even to get into our program, it's quite difficult. There was 700 applicants. There was 120 people that got in. So it's, everyone's very smart, and throughout the entire program, you always feel that you're not good enough until you get done, and then apparently the Canadian government thinks you're good enough. But basically, we walked out of there. I don't think either of us felt good. We got our results, and they were quite positive. And so just remember that maybe not all the questions count. You do know your knowledge if you do the time to study, like Harpreet was saying, that you just have to spend the time. It is time plus energy equals exam pass. And we do think this guide would help. And just because it is kind of a concise amount of information.
I have something to add.
Yeah.
So there are certain principles that really guide our practice in Canada that they might try to test you on. For example, patient-centered care. Depends very much on the scenario, and I think the principles for like foundation, like patient-centered care, collaborative goal setting. So it's a relationship where you work with the patients and everyone kind of collaborates into setting the goals of the treatment, rather than a top-down hierarchy where the physio like, hey, I'm the physio and this is what you're going to do because I know what's best for you. So little things like that it's hard to study for because it's not something you can memorize, but those are things that really guide treatment, treatment-like questions, or those what would you do in this scenario questions.
Basically starting, this isn't really a guide, this is more supplementary reading material that you have access to when you get into the course. And the way that we developed it was literally looking again right at the PCE exam blueprint, because all the questions that they're going to ask are directly from that blueprint. They can't really ask you things that are outside of it. Now there is a caveat, some of the questions aren't exhaustive, and that's what they say in the PCE blueprint. However, this is what I would say 99 or 95% of the questions have to do with these essential topics. So what an associate of mine, Agnes, who isn't here today, did was we collected all the information we could on each of these different bullet points. So basically looking at the table of contents, this is MSK portion, 3.4, 1. If you look at the PCE guide, the actual one that's posted on the PCE website, 0.1, 0.1, this is just basically general principles of joint mechanics, okay? And that's where we came up with this. And so what we did was we created information from several different sources, mostly from online open source materials. We found YouTube videos that we thought were useful, and then we created hyperlinks that would talk about some of the different core topics that maybe you guys would need a familiar point on, a reminder of, okay? So going back, this document covers MSK, it covers neurology, it covers cardio arrest, it covers multi-systems, it covers ethics, it covers pediatrics. Now, we can't promise that every single thing in this document will be tested on in the exam. However, we do think it's probably one of the most comprehensive documents that covers almost everything, if not everything, on the PCE exam. Okay? So moving on, I just want to show you a few of the different documents. We've talked a little bit about MSK, what it covers, and how we developed it. I'm just going to focus a little bit more on neuro.
Still another question. Why do students need this guide?
Why do students need this guide? Generally speaking, I think that a lot of people taking this course haven't been practicing for a while, or they've been trained abroad. And generally speaking, this is what we found to be the Canadian standards. This one is a lot more interactive. Students can also comment on it, and they can create forum and discussions. And from there, they can interact with each other and discuss topics that they're not quite sure on. There's also videos and just a lot of online material and sources that if you want to learn more, you can.
Yeah, I think the biggest thing about this guide is that you will find everything in one study material. So you don't have to go through different books. You don't have to go through a neuro book, ethics book, or cardio book. So you'll find everything in one online supplementary material. So everything is covered. So, 90 days or 30, 60 days before exam, you don't have to go through different books to read everything. You will have all the topics covered in one supplementary material, and you can just click on the topics. You can have ethics. I think we also have peds,
multi-systems.
Yeah, and then
But going over, for instance, I just want to spend a little bit of time on our stroke section. So, basically what this has is what it is, okay? The different terminology that's important for it. And then moving on, we have an actual picture of the circle of Willis, where the strokes would be. And then we have links saying what are the actual arteries that are involved in a stroke. And then we have the different types of where exactly neuroanatomically where the infarct would be. Going on, we have what the different symptoms would be if you had a stroke in a certain area inside the brain. And then going a little bit further on, what the signs and symptoms of strokes are, what the risk factors are, the pathophysiology of it, how the different healing times, which is something they absolutely do ask a fair bit about, and prognosis, signs and symptoms, and then basically assessment, which I think is pretty important and maybe is a little bit more varied across different countries. So what you would look for and how you would test it, and what some of the different posturing would be for stroke. And a lot of the terminology, because I think that might be slightly different from abroad. So we may call something slightly different here in Canada, and especially with stroke terminology, it's always changing, so it's good to have an updated source, and this source is constantly being updated. That's the nice thing about it being available online, so you won't actually have to have the textbook. You can just do it in the comfort of your home. And a lot of the materials offered in this course are actually online, so they do mimic in a fair way the way the PCE exam is taken anyways. So that's the other point I guess I would say, is that a lot of people that were trained 5-10 years ago, they're used to paper, and unfortunately the PCE isn't offered with paper anymore. It's offered all electronically using their online system and taking the test. It's just an online experience. So I think that getting comfortable using all of this technology and the links and learning online will help you be able to succeed a little bit better when you're taking that exam, okay? So again, I just think it's very conclusive. This is still all on stroke area and what would happen with stroke. So as you can tell, we're already on about 10 pages of stroke.
Just a question for you. So that guy could be getting updated continuously while, is any versions coming next to next? Like, suppose there's a guide today up to date, and after few months or few weeks later, you guys have added something new into that, which is required. Suppose the PCE added the new questions or anything, you guys become aware of some sources and all that. So you guys update continuously and provide to the candidates, or?
So basically, when there is any information that's been updated that we become aware of, then we would change and modify the guide accordingly. And if there's something that you guys have learned along your way that might be different than what you're seeing here, and you have a question about it, then what we encourage everybody to do is to insert a comment. Let's say it's right here, and you would write down, hey, what does this mean? And then we would look it up, respond to it, and then be able to answer that
Okay.
exact moment. Now, we don't want people to do that. We want them to, of course, look for themselves, see, okay, is this actually correct? And we do have sources throughout the document that people can look up new information. However, if they're not able to do that, so you do your first line of research on your own. If you still don't have the answer, or you think something's wrong, you post a comment. Your other students are also encouraged to kind of talk about it, and if that doesn't work, then we would also throw ourselves in there and modify it accordingly. And of course, yeah, there are changes that occur all the time in physiotherapy, so that's something that we would absolutely look at.
And another question: do you guys also have like a mock test or anything to
We'll
make sure the candidate?
we'll talk about
Oh,
that.
okay.
Yeah. Adam is going to talk about the guide. Ramesh is going to talk about the actual. Because the reason we wanted to do this online and in person, because we want to discuss some cases, just give some feedback. So Ramesh will talk about cases, what are traps. I will talk about all the online exams and stuff.
Great, thank
So,
you.
Yeah.
just a little bit more, I want to show you guys quickly the cardiorespiratory document. So again, they're broken up really nicely. It's basically a folder, and each MSK has 4 separate documents, and I think neurology has 4 separate documents, all numbered, clearly labeled, with table of contents that are easy to access. But basically, again, just going through it really quickly, you have kind of what your vitals are, what's normative values, and then you have different anatomy of the heart, and then you have a fair bit of pictures with links just to refresh your anatomy, and all of them have been sourced. So if you guys do have additional questions, EKGs, what they mean, things that probably we're not using in practice, but what might be important, okay? And then, I just think that there is a huge benefit to having it interactive in a sense, because when you're studying, the best way to learn is actually to kind of teach and to discuss amongst your peers, and having this online forum when you have about 15 students working on it, and they can comment and answer their own comments, it does seem to make a big difference. And again, we do think it is pretty conclusive and complete at this point, just because we did cover that whole blueprint, okay? So, and then the other thing I'll just say is a fair bit of the treatment that we learned for cardio arrest, that might be slightly different along the way, is also included in this doc. So how you teach breathing exercises, what are the parameters for breathing exercises, that sort of thing is also included. And of course, I didn't mention this, but a lot of the red flags for certain treatment options, especially for cardio arrest, I'll just flip up, might be in the next document. So if you are, there's all your condition scripts. So for pneumothorax, what does it look like? It just talks about what type of condition it is, and what you would see on assessment. So IPPA assessment, and that sort of thing. But basically, maybe it wasn't the first one, sorry. Just jumping back, it's very easy to navigate. You would go in and you would find where different treatment options would be. And of course, looking for your DVTs, that sort of thing. So, just basically, we do think it's quite complete, and if there is missing something that you guys want to see, we can always hear about it and update it and get it in there. So there's about 6 different documents that you guys can have. Another one would be modalities and medications. That's the other thing that I think might be helpful, because that would be possibly different from where you guys were practicing. So we do have kind of needling, IMS, some of the different lab values that people would come across. So when you're reading a vignette question, what's a normative value? Just depending on if you use the imperial system, and what is contraindicated for exercise, so platelets under 20,000. Just some of those different techniques, and then a few of the different Canadian standards for assessment rules. We have auto ankle rules and Pittsburgh knee decision rules, and just some of the things that we think are really important that are quite frequently tested upon. Okay, and how to read an X-ray, because now that the PCE is interactive, it's very possible for them to be adding images to the actual exam. So just what the different types of images are and how to read them. And I think that's generally it for what I want to say about this document. We just found it very, very helpful for when we were taking that exam, and generally speaking, the feedback that we've gotten, and through the first batch of students that went through this, we've had a fair bit of comments on it, daily comments, people are posting things. So for them to for it to be such a rich, full, interactive document, we think it's very helpful for students preparing for this exam.
So do we have to just cover the topics that are on the blueprint, or do we have to go beyond that topics to like?
Well, I think a very large starting point would be the blueprint.
Okay.
So, and as you do that, you'll find that once you cover myofascial syndromes, it just opens up a whole web of other conditions that you might want to research. However, this is your base, this is your map of what they're going to be testing on. So absolutely you want to focus in on what that actual blueprint is saying and not put your time and efforts into something that isn't covered in that blueprint. So like I said in the first time, if it's not on the blueprint, they can't really test you on it. However, the detail and the how specific they are on that blueprint covers a whole range of conditions. Okay? So that's generally speaking the document and how it works. So once you register in the course, you get access to the document, you get access to kind of the online discussion forum, and we do think it's a very valuable research source of material for people prepping for this exam, just basically because there is so much theory, there is so much reading that's actually required on it. So at least what we do recommend for students is to go over some of their own texts and that sort of thing, and to use this as supplementary material that has everything all together and see what's changed, what's mismatched, if there is a discrepancy, what it is. So the best way to actually study for this exam is to prep yourself using the blueprint, using this document, and just combining those two into your own kind of notes that combine everything. Does that make sense?
Yeah, and what's the success rate is like if we just follow the blueprint, what they have given us, and like if we just focus on that, what's the success?
So out of the first round, we've had 100% success rate at this point.
I've been asked this question a lot of times, that what's our success rate. So, we are here to give you feedback. We're here to give you material. We are here to guide you. But if you're studying, if you're, before classes, you're coming with, with your reading lessons and stuff, you're doing well in exams, you will definitely pass. But the success rate depends on you, right? So,
because like when at the first point we are just focusing more on the theory, not on the practical
Yeah.
Which
thing,
is
right?
completely
So-
legitimate.
Yeah.
Yeah, that's what you want to be doing.
Yeah. So like if somebody doesn't have that much practical knowledge, so will that be
So-
okay? Or
So this is not about practical. This is totally
Just
different,
about
right?
theory.
This is just theory. Practical is totally different. So this is all theory, and you just have to make sure you not think anything about practical. This is all about reading, answering how to, looking at the questions and see how to answer the best answer. Because in Canadian system, the answers are usually all right. The thing is, the difficult part is how to choose the best answer. Right? So that's the tricky situation. Identify any traps that are in questions, right? Choose what's the best option for this, right? So just change your critical thinking, right? The key issue with international grads that we found was that they have to change their critical thinking. They have to change their approach, how they read and answer the questions. So it's not typically, the most obvious correct answer is not the right. So I think it's usually sometimes the most safest answer, right? You need to think about what's more safe with the patient. So Ramesh will talk more about this. Adam, do you have anything else to say?
Yeah, just on that note, basically this exam is, again, a competency exam. It's very different than any other exams that you have. So when you're taking it, you have to really read it. It's also a marathon, so it's 200 questions, making sure that you are able to, that your time management for the exam is under control, because basically there are a fair bit of questions, and at the end of it you're exhausted, plus you've been studying like mad. And this is it's different than the practical component. However, if you do a really good job of theory, if you know your theory, it'll make the practical component easier. This is the first step, so I don't recommend you guys testing, doing cardio arrest assessments. I recommend that you guys read your notes and making sure that you're using this material to have a really clear picture on what is a safe assessment, what is a thorough assessment, what is a detailed assessment, and then from there, you know that in your head, and when you get to the practical component, it'll be much, much easier as well.
Okay. Thanks, Adam.
Yeah.